Stenosis is a postural condition, is strongly dependent on the way that your pelvis is being held. It was in 2009 when I went to a chiropractor's office. Clearly remember him telling me is, if we don't change something, you might be in a wheelchair by the time you're 30. My back pain started when I was in high school playing basketball, probably around 16 or 17 years old. It was a gradual onset, and it gradually got worse over the years. But there was a turning point, and that turning point was the same day as this X-ray that I'm about to show you. In 2009, when I went to a chiropractor's office, it was my first time seeing him. He X-rayed my spine, then adjusted my spine, and that adjustment was the turning point. My spine got significantly worse after that, and for the next 2 years it was progressively affected my life, and I was unable to surf or do anything really. 2 years later, 24 years old, that's when I committed my life to healing my own back and started on this journey. So this is my lumbar spine. And I remember this like clear as day. I remember it like it was yesterday. He took this image of my spine. This is me facing the side, so this is a side view of my spine. And he took a pencil and drew on the X-ray. He actually erased his pencil marks when I asked for the X-ray. After I realized my spine was injured, a few weeks later I went back to the office and I asked him if I could have my X-rays. And he brought them to me a couple minutes later, but the pencil marks were erased. So they're not there anymore, but I do remember that he took his pencil right about here and drew a little angle right there. And he said, you see this? This is your L5 vertebrae, and it's sliding off of your sacrum, which is here. Here's the edge of the sacrum. And the one thing I clearly remember him telling me is, if we don't change something, you might be in a wheelchair by the time you're 30. And that had a really major impact on me mentally, psychologically, made me feel broken. This was the examination portion of the treatment, and the exam was over, and it was time for him to treat my condition. He adjusted my spine, but he was unable to get the pop, the crack that so many people are after. And I think it was a little bit frustrating for him. He was doing what's called the lumbar roll, basically twisting my body, where they take the legs and your knees are bent and they rotate your legs one direction and then they rotate your shoulders the other direction. And so it twists you right at that lumbar spine and try to get a pop. You shouldn't try to get a pop, but many people do. So the pop is actually irrelevant of the treatment, but I think it was a little frustrating for him. He did several attempts and he's like, I can't get this one to go. He really threw his whole body weight into the final adjustment. I can't remember if it popped or not. I just remember a very abrupt force twisting my spine. I just remember it feeling very sudden and abrupt and intense. The first thing I really remember noticing was about a half hour, maybe an hour later, and I was jogging to go meet my friend at Angel Stadium. I just remember my spine feeling like it was shifting. It was the first I had ever had that feeling of just this like shifting, loose vertebrae. What it was, I didn't really fully understand it at the time, but my spine just felt loose. That was the beginning of my spinal instability, the beginning of a very painful period of time in my life. I lost a lot of ability to participate in fun things, activities that I like to do. So this is right before that. Now, let's fast forward. I had another X-ray taken of my spine. This was taken at UC San Diego Medical Center. So this is that same L5 on the sacrum and definitely less space there. So this is 2 years later. This is about the low point. This is another turning point. I actually got an MRI of my spine as well. And, it was at just kind of like a low point in my back pain. So even less space there. You can see in the previous image that you actually have some space between the sacrum and the L5. right there, some disc space. In this image, the disc had worn down even more over a 4-year period of, think about instability, think about just friction and essentially grinding on the disc. If that L5 is moving, unstable vertebrae from trauma and moving on the sacrum, it's just going to cause a lot of friction and wear and tear on the disc. So a lot less disc space going on there, associated with pain. The most recent image of my spine, which was taken, I believe, in October of last year. So I went and got X-rays of my spine for you guys. I had no idea what I was going to find because I had no imaging of my spine for 10 years. From 2013 to 2023, I never got any imaging. I completely ignored that, and I just went with what felt good for my body. But I wanted to know, what did it look like? And here we are. We have increased the space in, again, back between my L5 vertebrae, which is here, and my sacrum. And you can see that there is more space between the vertebrae when comparing 2013 versus 2023. And this is associated with no back pain. I was not having back pain at this time. It was just really interesting experience and documented through imaging that posture matters. The way that your muscles hold your body, whether you're doing activity, exercising, or at rest, it does determine the way that your bones are held. You can see my sacrum is more neutral compared with this image where my sacrum, which represents the pelvis, so your sacrum will represent how far tilted it is. My sacrum is almost horizontal in this image, and I have severe stenosis right here. My sacrum is touching my L5 from 2013. My pelvis is tilted a lot here. And we go to 2023, and you can see that my sacrum, the angle of my sacrum is much more neutral. This is how you want it. And the space between the vertebrae is increased. And I have maybe mild stenosis going on here. Stenosis is a postural condition, is strongly dependent on the way that your pelvis is being held. So we want the pelvis to sit in a more neutral position. And in this X-ray, I am actually doing a subtle core engagement, the type that we teach in the program. I was connecting to my anchors. That did probably have an impact on outcome of the imaging. Probably made it appear better than if I allowed my belly to spill out and my pelvis to fall into anterior pelvic tilt. That would tip the sacrum forward and close the gap here. So just some hope for you guys that no matter where you are, you can improve your situation. I would actually say that this image right here is not that bad, not too concerning. But I was uneducated at the time, and I was listening to someone wearing a white coat, trusting that. That's called white coat syndrome, when you just put all your trust into a power figure like that. It definitely had a lot of psychological impact from that experience. White coat syndrome is no joke. It's a real deal. I would recommend to anyone, anytime you're seeing a healthcare professional, to see them as teachers and educators, because they are extremely knowledgeable, and to learn from them. But don't give them the power to doom your life. So take their education, learn from them, and also go get education elsewhere. Get education from your own sources or other medical practitioners. And so you can accumulate all the knowledge from all of these different teachers, because the word doctor actually comes from the Latin root docere, which means to teach. And you accumulate your own knowledge, and then you make your own opinion, your own decision about your body from that knowledge. So if I could go back in time, that's what I would have done. I would not have let that statement that I might be in a wheelchair by the time I'm 30 have such a psychological impact on me to feel broken and not participate in life, because that was a contributing factor for why I continued to get worse. I stopped doing things because I was scared to do things and hurt my back, and not doing things made my body even weaker. It inhibited my core muscles even more, and my spine was even more vulnerable. So here's some bulging discs for you. There's my L4 disc and my L5 disc. This is from 2013, and there's, I'd say, a moderate bulge into the spinal canal. The program helps restore your posture, restores your core connection, and support your spine. And so bulges can get better too. Yeah, absolutely. We got to stay active. We want to stay active in a healthy way. And that's why all of this is here. This is why core balance training exists. So whether it was me sharing my x-rays, my past, my journey of getting worse and then getting better, maybe it can give you hope that you can get better no matter where you're at. And you can always improve upon today and make tomorrow a better day by treating your body as good as you possibly can. And I'll be back next week, as always. So until then, get down on the floor and connect to your core. All right, take care, everyone.